Hi, my name is Syarief, and today we're going to be talking about lupus. We're going to be talking about what lupus is, who gets lupus, what are the symptoms of lupus, and much more. But before I start with that, I want to start with the little known statistic that 1.5 million Americans and over 500 million people worldwide have some form of lupus. Now I want to start with that to show the prevalence of the disease, because despite how prevalent it is, 73% of Americans aged 18 to 34 have little idea or no idea at all as to what lupus is. So basically, this disease affects millions of people around the world, but not that many people actually know what this disease is. So what exactly is lupus? Lupus is an autoimmune disease. So because it's an autoimmune disease, that basically means that the body's immune system is in hyper-overdrive, and it can't tell the difference between the body's healthy tissues and foreign invaders. So basically, the body basically attacks itself, and it can affect tissues around the whole body. It can hit your organs, your nervous system, your skin, your joints, causing arthritis. But we'll talk about that more in symptoms. But it's not just an autoimmune disease, it's also chronic. There is no cure for lupus. It affects you the majority of life. Once you are diagnosed with lupus, you have lupus. There's no cure, but there are ways to treat this disease. Now, what are the symptoms of lupus? Like I said earlier, lupus can affect tissues everywhere. It can hit your cognitive functions by affecting your nervous system. It can make it hard to breathe by affecting your lungs. It can cause heart pains. It can cause rashes around the body. It can cause shortness of breath. It can cause fatigue. It can even cause arthritis in your joints. It can cause inflammation all over your body, muscle pains, bone pains as well, deep in your muscles. And pretty much it's very hard to live with lupus if you can't maintain the symptoms, because it can affect so many parts of your body that it can be kind of painful to do everyday tasks. So it is important to keep that in mind with this population, because these people are living with so many different symptoms that it can affect their quality of life in many various ways, basically. So what are the risk factors of lupus? So who gets lupus? Now, anybody can get lupus. It can be a male, it can be a female, it can be a child, it could be an adult, it could be an old person, it could be an African American, it could be a Caucasian, it can be anybody. But depending on what sex, age, or gender you are, or sex, age, or race you are, the chances of you getting lupus can be a lot different. So females are actually way more likely to get lupus than men. They're not exactly sure why. They thought it was something to do with estrogen and the hormonal difference between females and males, because females are 6 to 10 times more likely to get lupus than males, which is an absurd amount. But there's no underlying cause as to why. Researchers are now trying to study the differences between males and females in order to determine why females get lupus much more than men do. But as of right now, there's no known cause as to why that's the case with this disease. Now, age. You can get lupus at any age, but the most common age is 15 to 44. So that being said, with sex and age, women who are at childbearing age are much more likely to get lupus than men, young men especially. Now also, race plays a huge role in who gets lupus. African Americans and Hispanics and Asian Americans are much more likely to get lupus than Caucasians. Now, if you look at this graph over to the right, to the left, it has Caucasian men versus African American men. And you'll see 1 in 10,000 Caucasian men get lupus, but 5 in 10,000 African American men get lupus. Now, compare that to women. 10 in 10,000 women get lupus. 10 Caucasian women in 10,000 get lupus. Now, 40 in 10,000 African American women get lupus. The number, going from a Caucasian male to an African American female, the numbers skyrocket by a factor of 40, which is a lot to take into consideration. So African American females at the age of 20 to 40 are basically much, much more likely to get lupus. Now, there's also genetics also plays a role in who gets lupus, sorry. They're not exactly sure how. They just linked about 50 genetic variants that are linked with people who get lupus. And also, it is 20% of people with lupus have family members or brothers or sisters that either have lupus or will be diagnosed with lupus later on in their life. So there is some genetics in there, but it's not really well known. There's also special cases for how people can get lupus. There's drug-induced lupus, which basically, if people are taking medications that can have a negative side effect on their bodies that basically gives them lupus, but it subsides after they stop taking the medication. And there's also neonatal lupus, which basically is when in the womb, when a child is in the womb, the antibodies of the mother affects the tissues of the child. However, it's not the same as SLE, because once the child is born and away from the mother, about 6 months later the child is fine. The lupus subsides. So that's who gets lupus. Now let's talk about management and treatment. Like I said before, there's no cure for lupus, but there are lots of ways to manage and treat the disease. One of the most common medications for lupus is immunosuppressants, which is the most common medication for all autoimmune diseases, because, like I said earlier, the immune system is in hyper overdrive, and basically these serve to suppress the immune system and to stop the body from attacking itself so much. Now, there's also anti-inflammatories, because lupus can pretty much attack so many parts of the tissues around the body that it can cause inflammation everywhere in your knees and your elbows and so many different parts of the bodies. So anti-inflammatories are a big key to reducing inflammation. Corticosteroids also help with inflammation and reduces swelling. And also they help with itching too. And people with lupus can a lot of times get rashes all over their bodies. One of the most common things is butterfly rashes, which is around here, and it looks like butterfly wings, and it's all red, and it can be very itchy. So corticosteroids help a lot with that. There's also Rumatrix, which is known as the best drug for rheumatoid arthritis, and because lupus can cause arthritis in the joints, this medication is often used with not just rheumatoid arthritis patients, but people with lupus. Now, people with lupus also use over-the-counter medicines such as aspirin, ibuprofen, Tylenol, but that's because, like I said earlier, since it could affect so many parts of the body, these people are in pain a lot of times of their lives, and so they go to these over-the-counter alternatives just to help ease the pain. Now, there are so many different medications because there's so many different symptoms, which means there are so many possibilities for negative side effects. Now, I said earlier that lupus is chronic. One of the most common things with chronic conditions is depression, and a lot of these medications also have a side effect to cause depression. So these people are already affected negatively from the lupus mentally, and then they're taking these medications, and it negatively affects them even more. And a lot of times they just don't want to take the medications anymore because of the side effects that inhibit their quality of life. But there is another way to manage lupus without these side effects, and that is exercise. Exercise doesn't have any negative side effects, except if done improperly, it could cause more pain, but proper exercise can help with lupus tremendously, and it also can help with the mental health issue I was talking about earlier. Exercise is great for mental health, and it can help fight these side effects of these medications. Now, I'm going to talk about the benefits of exercise specific to lupus later on. Now, I had a patient come to me who was a 40-year-old female, and she has lupus. And she came first from a doctor and was then recommended to me, and she was cleared to work out. But she has knee inflammation, shortness of breath, fatigue. She's on immunosuppressants and anti-inflammatories. And she actually was on more medication, but is starting to weed herself off the medications because she cannot deal with the negative side effects of these medications. It's just too much on her. So she wants to try exercise and see if that helps her. And that's why she came to me. So she has a sedentary lifestyle. She has a resting blood pressure of 130/82, which is actually pretty good. Could be a little lower for resting, but that's pretty good. She has a total cholesterol of 210, which is slightly above 200, but it's still in relatively normal range. She has a BMI of 24, which is good for a female. And she has a blood glucose of 88, which is around 90, which that is good too. And she does not smoke, which is key. So when I went through prescribing her, I started her off at 10 to 30 minutes of light, moderate intensity cardiovascular endurance, 2 to 3 days a week. Now, this should be really low impact. And by low impact, I mean swimming, walking, biking, pretty much anything that does not place too much stress on the body. Because, like we said, living with lupus can be very painful. And if I prescribe her to go for a run or something and she has inflammation in her knees, that could be very painful for her. And she could associate the pain with working out and be just turned off to exercise completely. So you have to be really careful about that. So swimming is excellent, non-weight bearing, and walking, and it's up to her preference, but it has to be low impact. Now, flexibility is really important for those who have lupus because it can help with joint stiffness, because she has arthritis, so it's especially important for her to do flexibility 10 to 20 minute sessions a day, at least 3 times a week, in order to help fight the arthritis and to help ease the joint stiffness. I also prescribed some balance workouts such as stork standing, because body awareness is such an important part of lupus, especially if it affects the nervous system and you have cognitive defects and your balance starts to get affected. You want to start working on it early in life to make sure you have good balance to ease your quality of living or later on in life. And then resistance training is huge for those who have lupus because they need to build their muscles up, they need to build their bones up, and it also helps with joint support, which can help with her arthritis. So I prescribe her 30 to 60 minutes of resistance training, which should be really low weight. Like that, it's like the same thing with cardiovascular endurance. It should be low impact, no stress. So she should start at body weight or relatively close to body weight, and she can progress slowly as the weeks go on by. But it should start off at relatively low body weight. So anyway, for more information about lupus, you can go to the Lupus Foundation of America, and they have fundraisers, they have events, they have ways to donate, they have stuff like that. There's also the National Resource Center on Lupus, which has a lot more information on lupus, just medications, what research they're doing, clinical trials, stuff like that. And then there's also the American Center of Disease Control, the CDC, which provides a lot more information on disease and goes into detail about how the disease can be helped and what medications can be used. But anyway, I think that's about all I have. So thank you for your time and have a good one.